Hello radiographers, let's start MRI of left leg. So you can see that first HEST localizer has been completed and gives 3 images to plan, and now I am repeating this for the proper localizer. To get the proper localizer, for this I am planning on the HEST axial localizer, and for the sagittal localizer I am planning for the left leg, on the left leg, so that I can get a proper image of the left leg in sagittal view. So I am planning for second localizer, and now I am planning for coronal image, planning for sagittal image on the coronal localizer, and this is also a localizer. I am taking it for second time so that I can visualize the leg properly. So on sagittal image, angle the slice so that the coronal image in the proper shape, that the whole leg is visible, and then click apply, then continue. So my second localizer is running. So let's see how it provides images. So I have to wait for some times. For this MRI of left leg, I used body coil over the both leg. If you want, you can also do both leg together, because the coil covers the both leg including knee joint and lower thigh. But during planning I will plan only on the left leg. So the second localizer gives me these images: sagittal, coronal of both leg, and axial of both leg. So now I have to plan the T1 coronal, and for coronal I have to plan on the sagittal localizer and axial localizer. And because I want to do only the left leg, for this I will move the field of view over the left leg and so that the field of view covers from the knee joint to the lower leg. Doctor advice was MRI of left leg including knee joints, so I have excluded the ankle joint and included the knee joint with lower thigh. So this is the planning, coronal planning for left leg, and click apply. So T1 coronal plan have been finished, and T1 team coronal protocol opens, and for this planning I have to copy the planning from the T1 coronal and select the slice and saturation, and then click OK, and you can see that the planning is copied. And if the SAR limits exceeds, notification comes. There is 2 options: normal mode and fast level. So always try to keep normal mode, and there is 3 options. You can reduce slice and increase tier. I have select increase tier and OK, and the normal mode is running, and plan is copied from the T1 coronal, and click apply for team coronal. So I have planned 2 coronal for left leg, and the scan T1 coronal scan is running. You can see on the left bottom corner. I'm waiting for the scan to be finished so that I can plan more protocols. So T1 coronal sequence have been scanned. And now T1 team coronal is running. So let's check out the T1 coronal images. So these are the images of the left leg. You can see that very good quality images, and there is a part of that, there is some pathology in the patient's skin and maybe muscles also involved. You can see that a hypointense signal. So the whole tibia and fibula including knee joint is visible in this coronal image, and there is no artifact seen. So I am checking the images by changing them, and now I am selecting the sagittal sequences from the protocol section. And so let's plan the T1 sagittal first. So for the T1 sagittal, open the protocol and plan on the sagittal and axial localizers. For sagittal sequence, plan on the coronal and axial localizers. I am now planning on the T1 coronal and angle the planning so that the slices are parallel to the tibia. You can see that I have angled the slice, and the mid slice is over the tibia, and I paralleled it, and also on the axial image, and then click apply. For T1 team sagittal, no need to plan again, just copy the plan, select T1 sagittal, right click, copy parameter, and then slice and set region, okay, and then apply. You can see that the plan is copied, and then click apply. So now two sagittal protocols have been planned, and T1 team coronal is running. So let's print out the T1 coronal image. For this, in the viewing section, I am checking the T1 coronal image. You can see there is some abnormal hypointense lesion in the subcutaneous fatty area of the leg, and also my T1 team coronal image have appeared. Again, SAR limit exceeds. Try to keep it normal mode. For this, increase TR, don't reduce slices, increase TR, and okay. So let's go to again viewing. So there is two coronal image I got, T1 coronal and T1 team coronal. I am changing the images together and finding the pathology. Maybe something insert into the leg in the lateral aspect of the skin, lateral aspect of the leg, something inserted from the outside. For printing, select series and sending to the filming. And now in the filming, there is lots of images, so I have to select series and reverse series because the series is in inverse position. So I have to revert series to the proper for the proper orientation, and now changing the layout to the 6x4. So 6x4 makes the film makes the segments longer, and 24 images will be fit in the film, and there will extra 6 images that I have to delete. There is extra films for extra 6 images, so I have deleted this, and now there is one film and 24 left leg images in the film, and now I have to adjust so now I have to adjust the contrast and zoom pen the image, and also select the T1 team coronal and checking the image, checking the pathology, that is it involving the muscle or only in the fatty area. So select series and send it to the filming, and now go to filming, and it's already in 6x4 format, but the images are in inverse orientation. So I have to place the anterior part of the leg first and then the posterior. So for this I have to select series and reverse series so that the images are in proper orientation, and then delete the extra images so that the extra film is deleted. So I have to delete all these images. Now it's okay, and then drag the image, adjust the zoom pen and adjust the contrast. So now right now I am preparing two coronal sequence in the filming. One is T1 coronal and one is T1 team coronal. So team images gives us fat saturated images. So there is no signal from the fat, and after preparing print the film, and my T1 sagittal have been completed. You can see that the very good high resolution T1 sagittal images of the leg, and there is the pathology in the skin and subcutaneous fat of the leg. So select series, and now I am selecting the T1 transverse and T2 transverse. And also a T1 team tra. So I will take 3 transverse sequence, and now start planning. To plan the transverse images, plan on the sagittal and coronal image, and from the positioning toolbar change the view of the positioning block and drag the block to the over the leg, and also adjust on the axial images. And there is 50 slices. I will reduce the slice to 23 slice, and position the also changing the field of view to 250. So the resolution is slightly increased, and I will plan over this pathology on the leg. I will drag the block at the center of the pathology, and also on the sagittal image I will make sure that the slices are covered the pathology, and also check the axial localizer. And I have reduced, I will increase T average to 2 so that If you change the average, increase the average, the signal to noise ratio will increase, and if you decrease the average, the signal to noise ratio and also scan time will decrease. So after planning, T1 transverse is running and for T2 transverse protocol is open, and for this I have to copy the planning from the previous T1 transverse. But keep in mind that if you copy the planning, slice and saturation, the slice number and the slice planning is copied, but field of view is not copied. So keep in mind, and you have to change the field of view manually if even you copy the planning. And I have for T1 team Excel, I have also copied the planning from T1 transverse and apply. So for T1 tra, the average is 1 and the time is 1 minute 23 second. If I increase the average, you can see that the SNR is increased and timing is increased. So increasing average gives us high resolution images without noise. So let's check out the T1 sagittal images. This is the T1 sagittal, and you can see the pathologies in the subcutaneous fatty area of the anterior side of the leg. Actually it is anterior lateral side of the leg. Select series and send it to the filming, and go to filming and select the folder and change the layout to 6:4 so that the segments are long enough to fit the whole leg. And you can see that the orientation of the image is, I think it's okay, but there is some extra images, so delete some. So during deleting, always keep in mind that where is the pathology, and don't delete the images of the pathology. Delete the other images that is far from the pathology. And now adjust the zoom pan and contrast of the image. Also make sure that the pathology is visible in the film. Print out the film. So till now I have printed 3 films, 2 coronal and 1 sagittal, and this is a T1 team sagittal, and in this you can see the pathology very good. And in team sequence, the pathology is in hyper intense signal, and it shows on the black fatty signal, on black fatty area the pathology is bright. And in the filming, change the layout like before, 6:4, and adjust the zooming of the images and the contrast also, and also delete. You can see that the pathologies are in the posterior side, so delete the anterior images so that the pathologies are in the film. So make sure that the pathologies, all the pathology slices are in the film. So during deleting, be very careful and adjust the contrast so that the images are not very bright and very dark, and it will be in moderate contrast. and the background will be black, and print out. So now T2 transverse scan running, and T1 transverse scan have completed. Let's repeat the plan. Actually, I will make it for the post contrast protocol, and for this I am renaming it as FS because it will be fat set. So I will change the name to and add the FS letter, and now I will change the contrast from the contrast tab or contrast button, and then select fat suppress and change the mode to there is none, and select fat set. So this protocol I make for post contrast transverse sequence, and then click apply. Actually the sequence I made that was pre-contrast T1 fat set transverse, and I will compare. I take this to compare the post contrast images in the fat set axial, and this is the T1 transverse. For printing, select the series and send it to the filming, and also find the reference image of this series and send it to the filming. And now in the filming there is two films, so select the folder patient name and change the layout to 4:6 so that 24 images fit in the film, and zoom the image, zoom in the image so that it fit in the segment, and there is reference images in all the segment. Remove it from the properties and tick out the reference image, and then click OK, and you can see that there is 23 axial images and one reference image, and adjust the contrast of the images. Also adjust the reference image, slightly zoom in, and print out. And this is T2 transverse. I am checking out the transverse images. Select series and send it to the filming, and also send the reference image for T2 transverse, and also send it to the filming. And now in filming again change the layout to 4:6. That means the 24 images will be fit in the film, and also tick out the reference images. And reduce the labeling of the segments. There is in all the segments there is the information written, information of the patients and the parameters. Adjust the contrast of the image. And there is the pathology visible anteriorly of the leg. And this is team coronal. So select the series and send it to the filming with the reference image and change the layout to 4:6 and reduce the markings of the films, and also adjust the reference image, slightly zoom in and pick out the reference images of the segments, adjust the contrast so that the background of the image is black, and print out the film. And now my pre-contrast T1 axial fat set is running, and now I will inject contrast, and for this I have to select the injection button and tick mark the patient has contrast agent and change the volume to 10, and the agent name will be post contrast, and this marking will be on the images. So now I have to repeat the protocol, repeat and open the protocol, and the pathology is inside the slices, and make sure that the injection sign is showing here. Now I am preparing for contrast, waiting for contrast is given. So I have to make the post contrast protocols. Only one is been prepared, the T1 transverse fat set. So I have to move in the patient from the table positioning after the contrast is given, and then start the post contrast scan. So my first post contrast scan is T1 transverse fat set that is running right now, and a injection sign is appeared in front of the protocol. And now I have to make coronal and sagittal post contrast protocols. For this I have select the T1 coronal that I previously take and repeat this, open this, and at first I have to change the name of this sequence. I have to add FS, that means fat set, and click OK. I change the name of this protocol to fat set, but I have to change the contrast of this protocol from the parameter fat suppression, change to fat set, and then click apply. So the name and also the parameters have been changed to fat saturation. Then now T1 transverse running, and after that the T1 coronal fat set will start. And now I am dragging the T1 sagittal down to make it fat saturation. First rename the protocol at FS, that means fat set, at the end, and then click OK. You can change the name of the protocol from the properties. Right click on the protocol and the properties will appear, and also from the parameter change the contrast of the protocols and change it to the fat set so that the images are fat setted after giving the contrast, and click apply. So T1 transverse and T1 coronal fat set and T1 sagittal fat set post contrast protocols have been running. This is T1 coronal fat set. You can see that the contrast is enhanced in the pathology. For filming, select the series of the transverse fat set images and send it to the filming, and also the reference image, and select the patient folder and change the layout to 4:6. Now I am filming the post contrast images. So at first I am filming the T1 transverse fat set post contrast. You can see that in the pathology there is a bright signal and contrast is taken in the pathology, and after completing print out. And now this is a T1 coronal fat set. You can see that the fat is not saturated homogeneously in all the area of the leg. So send the T1 coronal fat set images to the filming and also the reference image, and now make this layout, film layout, to 6:4 so that the segments are long enough to fit the whole leg, and select series and reverse the series to make the images from anterior to posterior oriented, and delete the extra images from the posterior side. And now adjust the zoom pen of the image and adjust the window, and also adjust the reference image. So this is T1 coronal fat set post contrast, and take out the reference image from the segments and select series, adjust the window so that the background of the image is black, and print out. Now the only one remaining is the T1 sagittal fat set post contrast. This is the lesion. It will be an abscess. Select the series, send it to the filming. Also set the reference image. Select the folder and change the layout to 6:4 so that the segments are long, and there is extra images, and the orientation is okay. You can see that the tibiofibular joint is in the posterior side. Because this is left leg, it should be on the posterior side of the image. Delete the extra images and adjust the image to fit the window, to fit the segments. And give the patient information, all the information, at least in the first segment, and then print out. So this was the MRI of left leg. Thank you everyone. Hope you like this video. So please subscribe my channel and hit the like button and for more videos.